Morning. Senate Health, Education, Labor, and Pensions Committee will please come to order. Today, we are holding a hearing on our federal response to the COVID-19 pandemic. Ranking Member Burr and I will each have an opening statement, and I will introduce our witnesses. After they give their testimony, senators will each have 5 minutes for a round of questions. While we are yet unable to have the hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov. And if anyone is in need of accommodations, including closed captioning, please reach out to the committee or the Office of Congressional Accessibility Services. We are at a point of great promise and peril in the fight against COVID-19. While I am encouraged by the fact that 2/3 of adults in our country have received their first dose of vaccine, I am alarmed by how the rate of vaccination has been slowing and how, driven by the Delta variant, rates of COVID-19 cases and deaths are once again on the rise. 5 counties in my state currently have high levels of transmission, according to the Centers for Disease Control and Prevention. For example, in Walla Walla County, cases are up in July from June, and they were up in June from April and May. And even though 99% of the COVID deaths nationwide last month were among people who had not gotten vaccinated, we are still seeing fear and misinformation hold people back. Huge disparities in vaccination rates among communities of color and rural communities, skepticism about vaccines among some religious and conservative communities, and slow uptake among young adults. Vaccines are safe, effective, and free and easy to get. We need to make sure people know that. And we also need to make sure they understand choosing not to get vaccinated doesn't just put themselves at risk, it puts the people around them at risk, including people who are immunocompromised, like those fighting cancer, and kids who are not yet eligible for vaccines. We also have to remember vaccinations are just one front of this fight. Local health departments need the capacity to track emerging outbreaks quickly through contact tracing, sequence virus samples to identify variants, help isolate ill people, and track vaccination progress and more. Experts need to evaluate the longevity of immunity, especially in the face of new variants, and the potential value of booster shots. Researchers need to study the long-term impacts of this disease and how to treat long-haul COVID-19 or PASC. And perhaps most importantly, we as a nation need to fully learn the lessons of this pandemic and take action so we are never in this situation again. That's why Senator Burr and I have been working on bipartisan legislation and oversight to build the world-class public health and preparedness infrastructure our people deserve. It is my hope that through this work, we will not only address challenges we faced during this pandemic, but build on progress we saw in some states across the country. In my home state of Washington, they worked to overcome challenges with sharing critical COVID data among health departments, labs, and hospitals to improve how data was used to allocate critical medical supplies like respirators, and develop a more complete dashboard for demographic data that broke out numbers, for example, for the Pacific Islander community. Michigan created a task force on racial disparities early on in the pandemic to ensure they were reaching communities of color for testing and contact tracing. And Alaska literally employed every mode of transportation to deliver vaccines to hard-to-reach communities. One of the clearest lessons from this crisis is that you should have the same protection from a pandemic, chronic disease, or a public health threat, regardless of where you live, who you are, or what your income is. And one of the best ways of providing that level of protection is through strong public health infrastructure. The stronger our health departments are at every level, the more effectively they can work to use sequencing technology and modern data systems to track the spread of diseases and monitor the success of vaccination efforts, stand up testing and contact tracing to stop disease outbreaks, develop science-based guidance to address local needs, build partnerships in hard-to-reach communities, and build trust as communicators and fight misinformation. There is a saying in healthcare, an ounce of prevention is worth a pound of cure. We need to have that same mindset when it comes to public health. That's why I've pushed for more funding for public health departments throughout our COVID response packages. It's why earlier this year, I reintroduced legislation to end the cycle of crisis and complacency in public health funding by providing $4.5 billion in dedicated annual funding. And it's why I'm going to continue pushing for us to make these critical investments. We all want this pandemic to end, and it is clear despite the incredible progress we have made in the last few months, we still have a lot more work to do.